address, and rapid rehousing, I apologize, and rapid rehousing under CoC. It will not address eligibility under ESG, homeless prevention, and rapid rehousing. We're keeping it very specific to CoC. And we'll also talk about the documentation requirements for each of these, for each type of program. Okay, so the definition itself under HARTH became effective for all new and renewal projects that were funded in the fiscal year 2001 competition. And that means, and this is always really confusing, if a project was funded in fiscal year 2011, I said 2011, the first contracts that were impacted were those that ran from 2012 to 2013. Right now, we're operating under contracts that run 2015 through 2016. So basically, these have been in existence for a while. So these are the definitions you should have been operating under and should be operating under right now. Lee's going to say something.
Hi, everybody. I just wanted to reiterate something that Barbara said, which is these definitions that we're going to review have been in place for a while. But one of the reasons that we're sort of going back to basics for the purposes of this first webinar is that in reviewing programs, APR's data, as well as our ACAR data, the annual homeless assessment report that goes to HUD for our entire continuum of care, one of the things that has been noticed is that we do have folks in programs that are coming from ineligible destinations. So we either have a data quality issue in terms of the data being entered into HMIS, or the issue is that we are serving folks in programs that are in fact ineligible, which is a concern for many reasons, including the fact that as providers, if you're audited from HUD, if they come out for monitoring, that can be a finding. Obviously, we want to avoid that. Also, because as a continuum of care, our performance is based on our ability to end homelessness for the folks within this definition as being required by HUD. So we want to make sure that we're using our resources to effectively target those folks that HUD is instructing us to meet their, to resolve their homelessness.
Thanks. Just a few housekeeping things that I sort of got so excited about leaping into the facts that I just wanted to go back and say a couple other things. First of all, you are all muted. So if you do have a question, the way we will know that is there's two ways to do that. And Dave, you may want to help me explain these. There's a way, there's a place that you, in the chat box, to say that you have a question to send. And I understand that's probably in the upper right of your screen, but Dave said it could also be in the top of your screen or the upper left of your screen. So anyway, there should be a chat box on there that allows you to ask a question. And or there's a way to raise your hand, and at that point, Dave will unmute you. So we're going to, and we'll stop a couple of times for questions and answers. Dave, did I explain that properly?
Yes, you did, Barbara.
Okay, so everyone hopefully understands that you will have a way to ask questions and be included in all this. It's very hard. I think we may have like 100 people on this webinar. So, but it's, you know, we want people to be able to ask their questions. If for some reason your question doesn't get answered or it was not clearly answered enough, please feel free to send emails to us at the usual website, pa_coc@hotmail.com, and we'll get back to you. And if it seems like a question of broader concern, we'll send those out. We'll send responses out in an email also. Okay? Okay, onward. So the homeless definition under HARTH has 4 categories. And HUD finally refers to them as Cat 1, Cat 2, but Category 1 is literally homeless. Category 2, imminent risk of homelessness. Category 3 is homeless under other federal statutes. And I'm going to say this a couple of times, that this one doesn't exist in Pennsylvania Continuum of Care, and I don't think it exists in any of the Pennsylvania COCs, and maybe not even nationally. And basically the way I'll talk about it again later on. Category 4 is fleeing or attempting to flee domestic violence. So let's look at Category 1, literally homeless. An individual or household who lacks a fixed, regular, and adequate nighttime residence. So public or private place not meant for human habitation, living in a shelter, exiting an institution where he or she has resided for 90 days or less and who resided in one of the above immediately prior to entering the institution. Okay, that this is a nuances of changes from the way it was in the past. So there could be more fun ways to do this, but because we're on a webinar, we can't do a fun way of doing it, but we're going to try. So no one go ahead in there. If you have printed out your PowerPoint, don't look. So John has been living in the garage behind an abandoned commercial building in Carlisle for the past 6 months. This past January, he was treated at an emergency room for frostbite and spent a week in the hospital. John was discharged to live with his aunt to recover, which was good discharge planning on the part of the hospital, where he's been for the last 2 weeks. So the question becomes, is John eligible as homeless for Category 1? No, he's not, because his current residence is living with a family member. So that makes him ineligible as Category 1 homeless. And we'll talk about what the implications of not being eligible for Category 1 is, because each program has different types of categories that can serve people. But remembering under Category 1, although it was a good discharge plan, they not be discharged to a shelter. That's what we're looking for from the hospitals. It did eliminate his Category 1 eligibility. Okay. Sam was evicted from his apartment around 5 months ago and subsequently drifted from one friend's home to another. He is currently an inpatient in a psychiatric facility and is expected to be discharged after spending 60 days there. Is Sam homeless? Nope. He was not literally homeless prior to his hospitalization. He was going from house to house. He was doubled up. People call it couch surfing, but he was not in one of the literally homeless categories. So no, even though he was discharged within the proper amount of time, it had been, you know, he's not considered homeless under Category 1. Okay. Mary and her 3 children have been in an emergency shelter program in Easton for a week. Yes, she is. She and her family are homeless because their current residence is an emergency shelter. Okay, moving on to the next definition, Category 2. Okay, under Category 2, imminent risk of homelessness. And I find this one the most complicated, so let's just look at it. Individuals or families who will lose their primary nighttime residence within 14 days and have no subsequent residence identified and lack the resources or support networks needed to obtain other permanent housing. Okay, so let's look at some examples and see what we think. In 2015, Susie and her 3 children were evicted from their home in Altoona for non-payment of rent. They went to live with her sister Mary's family in Hollidaysburg. Last week, Mary said that Susie has to leave within the next 2 weeks because her landlord threatened eviction, because Susie's family is not on the lease. So Susie's not being threatened with eviction from the landlord, but she's being told by her sister she has to leave. Susie works a minimum wage job and has been able to save a small amount of money with a total of $500 in the bank. Although she has looked, she cannot find an affordable unit. Is she at imminent risk of homelessness? Yes, because she will lose her residence within 14 days. Her sister says, you have to leave or I'm in trouble. She has not identified a place to go, and she doesn't have the resources for permanent housing. Her savings and her income are not enough. So she is at imminent risk of homelessness. She's eligible under Category 2. She's not eligible under Category 1. She was doubled up, but she is eligible under Category 2. Okay, Kathy and her 3 children have no family in Honesdale. She had been working but lost her job and could not pay her rent for the past 3 months. She received an eviction notice yesterday and must vacate within the next 30 days. So she just got her eviction notice, and she has 30 days to either solve this problem or leave. Is she at imminent risk? No, because it's within the 30 days, not 14. So not right now, but within 2 weeks, unless she has found a way to resolve issues with her landlord, has found a way to meet her rent, come up with a payment schedule, come up with a way to stay put, she will become eligible under Category 2 in the next 2 weeks. That's not ideal. Ideal is that she find a way to stay put, but if she can't, she will be considered imminent risk and eligible under Category 2. Okay. Harry lives in Newcastle. His landlord threatened to have, somebody's not muted. Dave, I don't know if you can check that.
Yeah.
Harry lives in Newcastle.
Okay.
His landlord threatened to evict him, so he moved in with a friend temporarily.
Okay. Right, thanks.
No, he's not at imminent risk. He's currently doubled up. Okay?
Oh, I didn't realize.
All right. Those are the examples under Category 2. Now we're going to look at Category 3. Like I said, we'll talk about it again briefly. It's not eligible for our CoC programs in PA 509 in the east, 601 in the west, because to be eligible, a CoC must document that it no longer has a need for the program for the programs in the that serve no longer have a need for programs that serve individuals in Categories 1, 2, and 4, and therefore they can move to a broader range of people. We right now have, based on our point-in-time counts, we still have plenty of people in Categories 1, 2, and 4. So, who in the Pennsylvania Balance of State regions is eligible under Category 3? No one. So sometimes when people fill in their applications, they sometimes check off the that category. It's not eligible, and we'll always write back to you and say, no, you can't do that. Okay, now on to Category 4, fleeing or attempting to flee domestic violence. This is any individual or family who is fleeing or is attempting to flee domestic violence, dating violence, sexual assault, stalking, or other dangerous or life-threatening conditions, has no other residence, and lacks the resources or support networks to obtain other permanent housing. Persons who are fleeing or attempting to flee human trafficking may also qualify as homeless under Category 4. This is a categorization that just came up in the 2015 application. I think the details are still being clarified, but it's this is a new aspect of domestic violence in terms of HUD. I believe domestic violence programs have been working with this population for a long time, but in terms of HUD, this is recent. So Betty and her baby have moved out of their home and have gone to live with her mother in Puxatawny because her husband was abusive. So is she homeless under Category 4? No, she has a support network to find other residents. Her mom took her in, and she has a support network. So under this definition, she's not considered homeless. Patricia's husband injured her, and she sought medical treatment at the hospital. She's afraid to return to her home in Waynesburg, has no family nearby, and has no income or savings in her own name. She has never worked. Yes, she's fleeing domestic violence. She has no other residence, and she has no resources. So yes, she is eligible under Category 4. Nancy and her 3 children needed to leave her boyfriend because he abused her oldest child. She sought help from the Domestic Violence Services Organization and has spent the past 30 days in their shelter in Butler County. Is she homeless under Category 4? Yes, she's fleeing domestic violence. Also, she's Category 1 homeless. She's living in a shelter. Okay. This is weird. Something on my slide did not come up. Oh, here they are. Lee made my slide fancy, unbeknown to me. Okay, so I'm going to make my slide unfancy. Oh, no, not anymore. Okay, so the relevance of these categories to each type of program, and we'll go through these program by program also, but permanent supportive housing and rapid rehousing. Category 1, literally homeless. Category 4, fleeing or attempting to flee domestic violence. Transitional housing and supportive services only, literally homeless. This is where imminent risk of homelessness comes in Category 4, fleeing domestic violence. This is an important distinction between, there's a lot of distinctions between rapid rehousing and transitional housing, but I think the biggest one for those who switch their programs from one to the other is imminent risk of homelessness does not make a household eligible for rapid rehousing. So those projects that have, especially those transitional housing programs that made the change largely because they went from leasing to rental assistance, and by doing that, transitional housing becomes rapid rehousing. have to be aware that Category 2 is not an eligible population under rapid rehousing. And then the last one, we only have 2 safe havens in our balance of state, but only Category 1, and it's limited to those on the street and unwilling or unable to participate in supportive services. So let's look at permanent supportive housing, literally homeless, or fleeing domestic violence. And each year in the NOFA, HUD has the opportunity to sort of add additional criteria that are not in the actual rule. So what they added in 2015, so in the 2015 NOFA, they also added individuals and families coming from transitional housing must have originally come from the streets or emergency shelters and must have a family member with a disability. These are sort of specifically laid out in the NOFA. Also, so if you look, a family member must have the disability. Back in the day, it used, for shelter plus care, I believe, it had to be the adult in the household. And I think for supportive housing, it could have been any household member. Now that there's not 2 different programs, now that everything is considered supportive housing, even the old shelter plus cares, it's any family member with a disability. However, for those programs that serve chronic, it has to be an adult member of the household who has the disability. We will go back to the next webinar, which is on March 15th. We will discuss this in more detail in light of the new chronic definition. Also, in the NOFA, and we don't have this on the slide specifically, but households fleeing domestic violence. Lee, do you want to do this one?
It's on the slide, Category 4.
Okay, good. It was on the floor. Okay, slide. Okay, we didn't have to add it. Okay, we're good. Okay. This next slide we added in specifically relating back to what Lee started the webinar with when we said that we looked at a bunch of APRs and we found that people entering permanent supportive housing programs were entering from ineligible locations. We don't know if this was incorrect data entry onto HMIS or whether this was actually people entering the programs who are coming from ineligible locations. So we kind of made a slide specifically to put it right out there. So, and this is right off the APR question number 20 of prior residents. Which of these are eligible? So the ones on this slide are all eligible. Emergency shelter, transitional housing, places not meant for human habitation, safe havens, institution if they're there 90 days or less and came from one of the above prior to entry, permanent supportive housing for homeless persons, and rapid rehousing for homeless. Now, if you go, the next slide shows ones that we saw on people's APRs, and these are not eligible. Residents owned by a client, residents rented by a client, hotel, motel paid by the client, staying or living with family, staying or living with friends. These prior residents are not eligible under permanent supportive housing. So I would suggest when those of you who have permanent supportive housing programs, when you do your APR, please look at this question and make sure everyone entering your program shows up as eligible. Okay, now moving on to rapid rehousing. Again, Category 1, literally homeless, and Category 4, fleeing, attempting to flee domestic violence. This became an eligible group only under NOFA, the 2015 NOFA. If a program was originally funded under 2013 or 2014, they're only eligible under Category 1. We have also asked HUD for some additional verification of this, but this is what is currently in writing. So I just want to make sure everyone sees this. At 2015, rapid rehousing opened up for domestic violence, and that wasn't the case. We only have a couple programs funded originally in 2013 and 2014, but this is the 2015 rule. We don't know what 2016 will look like. Okay, then under transitional housing, people who are literally homeless, imminent risk of homelessness, and fleeing domestic violence are eligible. So if you go back, I don't know how many of you can flip through your slides easily. If you look back at slide 13 where we had Susie, and she had to leave her sister and had no money and had no other supports. She was Category 2. Okay, safe haven, category 1, literally homeless. Safe haven projects have the following additional NOFA limitations on eligibility. Like we said, the NOFA allows itself to sort of change the interim rule, and the additional limitations are must serve single individuals only. Individuals must have a severe mental illness. Individuals must be living on the streets and unwilling or unable to participate in supportive services. So this is for unsheltered individuals with severe mental illness. That is the limitation now on safe havens. I think that's a narrower limitation than was originally in these programs. So if you are operating a safe haven program, or if you're referring to a safe haven program, this is important. Supportive services only, can serve category 1, literally homeless, category 2, imminent risk, category 4, fleeing domestic violence. Okay, we are going to pause it here. That was a lot of words, a lot of definitions, and a lot of like little bitty facts. So I'd like to open it up here. Dave, can you check and see if there's any questions in the chat boxes, please?
So let's see. As of right now, there are no questions.
Okay. Anyone want to raise a hand about this?
There was one question around domestic violence and their eligibility with rapid rehousing projects. I guess what you went over just clarified things, how category 4, fleeing domestic violence, can consider someone as homeless. Therefore,
for someone who is funded only for rapid rehousing projects funded in the application that went in this past November, FY 2015 application.
Right.
And this is CoC. This is not ESG, and we're not going to even touch that because we don't want to mess it up. But under CoC, projects funded in the 2015, so these are ones that we don't know if they've been funded yet. They're brand new. We're awaiting HUD's announcement. And if they are funded under FY 2015, fleeing domestic violence is eligible.
And just to also add to that, one of the things that we are looking to clarify right now from HUD is if a project was initially funded in 2013 or 2014 as rapid rehousing, if as a 2015 renewal project, if that rapid rehousing program can also serve that category 4 fleeing domestic violence population as well. So as soon as we get additional clarification from HUD, we can share that information with those rapid rehousing programs that were funded initially in those years, which, as Barbara indicated, are only a couple.
Okay. Any hand raises, Dave?
There's a question in the Q&A that says, if a chronically homeless person comes into transitional housing, literally homeless upon entry or entrance, can they move out of transitional housing? And is it to permanent housing dedicated to chronically homeless? Do they maintain their chronic status?
So the answer in general is no. HUD has recently, in some of the documents, come up with sort of little caveats to this, but in general, the answer is no. The requirement for permanent supportive housing is that somebody be coming from the streets or shelter, or if they were previously in, if they're coming from transitional housing, that they were previously in a shelter or on the streets. So in terms of eligibility for permanent supportive housing, the individual would meet that criteria. However, if it was a chronic designated bed, the individual would not be eligible at that time because you lose your chronic status in transitional housing. Like I said, HUD is sort of...
I actually have something to add to that. We'll get into this when we do the chronic webinar. However, I did... somehow this little tidbit stayed in my head. If a person is chronically homeless and was placed in transitional housing briefly, because that's the only safe place for them to be housed while waiting for a permanent placement, they can maintain their eligibility for permanent supportive housing for chronic.
Right. That's the caveat I mentioned.
Yeah.
Okay. But if folks are serving chronic, definitely please bring this and any other questions to our attention as soon as possible. Actually, the more that we know about what questions folks have around the chronic definition and documentation, the more we can include those questions ahead of time in the next webinar in March.
Yeah, please do. Send them into PACOC. We'd like to have the questions in advance so we can make sure we don't miss anything, thankfully.
Or if they're sort of complicated to type out, you can always call us.
Yeah. Any hand waves there, Dave? Any more questions?
So I have a question. There's a question here. I'm not very sure what FIS means, but is there type the next rest. Is there anything that the housing authorities will need to ask for when they are coming in for a shelter plus care program voucher?
Well, is there anything? Okay, shelter plus care is permanent supportive housing. Therefore, all the things that we raised, any time the words permanent supportive housing are used in this webinar, that is shelter plus care. So that is the eligibility criteria for shelter plus care. That used to be two separate programs. Shelter plus care was one program. Permanent supportive housing was a different program. With the HEARTH Act, these programs both got combined into what's called permanent supportive housing. Therefore, all regulations that relate to permanent supportive housing relate to shelter plus care. So the programs that probably have the biggest learning curve in terms of definitions, documentation, and eligibility would be the shelter plus care programs, because it is a shift. They're no longer something different than anybody else. They may still call themselves shelter plus care because that was their name, but they are now permanent supportive housing under HEARTH. I believe that was what the question was.
I guess that also would apply to this other question where if they enroll somebody into a rapid rehousing program and then exit them from the rapid rehousing programs and enter them into a permanent supportive housing program, then that person would no longer be homeless if they had not moved in to a physical address through the rapid rehousing program, correct?
Well, I'm sorry, where would they have been? You lost me.
So they could be receiving case management through the rapid rehousing program before they're actually physically in a unit. So they could be receiving case management and then be placed into permanent supportive housing when they get put in that physical unit.
I mean, I conceivably, yes, that could happen. They could be getting case management services while still being unsheltered or living in a shelter while a unit was being located. To answer the question the same way the transitional housing question was answered, I will just say that if somebody is in rapid rehousing, that person does maintain their eligibility for other permanent supportive housing, so it is different than transitional housing. If you are, this is sort of a little bit confusing because we don't consider folks who are housed in a rapid rehousing program to be homeless, but for eligibility purposes, they do maintain their homeless eligibility. And therefore, if somebody, for example, if you don't have any vacancies in a permanent supportive housing program and you encounter somebody who, for example, is chronic and you want to house them, you have the ability to house them immediately through rapid rehousing, you can do so. And then once a permanent supportive housing unit becomes available, they maintain their eligibility for permanent supportive housing. They also maintain their eligibility for a chronic bed or unit. That is very different than transitional housing.
However, they must have a disability.
Yes, they must.
And it must be documented.
Yes.
We'll talk about documentation in a second. Okay, are there other questions or hands up?
Just one other question. In someone's original permanent supportive housing project, they were accepting people coming in from the shelter and on the street. They were wondering if they can also accept folks from safe haven and hospitals now.
For transitional housing, you said?
For permanent supportive housing.
For permanent supportive housing. People in safe havens are eligible for permanent supportive housing, yes.
But again, we only have two HUD-funded, I think only one HUD-funded safe haven at this point. Two.
Unless they've merged.
I think they did, and they're in Washington County. So.
One's in Washington, one's in Westmoreland.
Okay, there we go. Washington and Westmoreland. We've got two. So those are the only counties where that piece of the question is relevant. Then the next piece of the question?
The next piece of the question is about hospitals. The answer would be relevant to one of the first slides that Barbara went over in terms of literally homeless. If somebody was in the hospital for a short stay, specifically less than 90 days, and they were literally homeless prior to entering the hospital and there is nowhere else they can enter, then yes, they would have to have their literal homelessness documented from prior to the entry into the hospital. So as long as they can collect the documentation needed for that, that they should be eligible, yes.
Okay. Any other questions coming in, Dave?
I think that's it for now.
Okay. If anyone wants to revisit this section of the webinar with questions next time we open it up, feel free. It's not a problem. We'll just, you know, if we were live and in person, we'd answer questions whenever they came up. So we're doing the best we can with it. Now, okay, we've looked at definitions. We've looked at what program people would be eligible for under these various definitions. Now, this is a part of a HUD compliance thing. You have to have the proper documentation in your files. And the documentation is very, very precise, but you'll see. It's a little bit, it gets mushy as we move along. But anyway, the HUD has established three standards for, in terms of their preference for the documentation. The first is a third-party documentation. That means it not coming from the homeless individual themselves, but coming from somebody else. The second one is an intake worker observation, and that relates largely to outreach, and we'll talk about that in a second. And then the third is certification from the person seeking assistance. That is eligible, but it is the least preferred in terms of documentation. So you shoot for the most preferred first, and then do what you have to. So let's look at category one. Remember, that's literally homeless, streets, shelters, or coming from an institution where they've been on the streets or shelters before. So the highest level of documentation would be a written referral by another housing or service provider. Now, that seemed a little goofy to Lee and I, another housing provider, in light of the fact that they are probably unhoused, but we think what HUD is saying from a shelter provider. So if a person has something showing that they stayed in shelter ABC, that was proof that they were in a shelter, or a service provider who had been maybe going in and doing some sort of a casework within the shelter, they can also document, yes, I saw Mrs. Jones and her 3 children in the shelter. That is where they're living. The second one is observation by an outreach worker, that someone encountered someone, you know, living in what we regard as an unsheltered location, and yes, I saw them there on Tuesday night. That is where they're living, and that can be used. The third is certification by the individual or head of household seeking assistance, stating that he or she was living on the streets or in a shelter. And that certification must be in the file. Then the added on piece, when this was something that was raised in one of the questions, for individuals exiting an institution. One of those other forms of evidence has to be available to show the prior documentation of homelessness, okay? Then, in addition, because the person's, that's not their most recent place, they also need to show discharge paperwork or written or oral referral from that agent, from that place. So let's say someone is leaving a hospital where they were for a week. That hospital, like the discharge social worker, can call a permanent supportive housing program and say, or when we have coordinated entry, they can say, Mr. Jones was here for the week. He entered here from an unsheltered situation, if they know that. Otherwise, that someone else has to provide that other part of it. What the discharge person would do is just say how long they've been in that institution and when they left, and a written record of the intake worker's due diligence to obtain this information, and certification by the individual they exited the institution. It seems to me, though, that exit paperwork from an institution is fairly easy to get, because whenever you're discharged from a hospital, they give you that piece of paper with all the instructions on it. So there's usually something that shows that you were in an institution. But in light of not being able to get that, the intake worker can show how hard they tried to get it, and a certification from the individual. Okay, so we're going to try to figure out if these people have adequate documentation for Category 1. Allison has a letter for an emergency shelter in Meadville saying she's staying there but cannot remain more than 30 days. Well, if it's a letter from an emergency shelter, and there she was, yes, she's eligible under Category 1. Sam is living in a 30-day substance abuse recovery program in Williamsport. In preparation for discharge, he applied for permanent supportive housing. So this is good. You know, application is in. He knows he's going to be leaving. He knows that this is a limited time stay. He knows himself that he was homeless prior to entering this facility. He has provided his discharge paperwork and his self-certification. He was living in his car prior to entry to the institution. So yes, he's documenting his homeless status. He's documenting how he's providing documentation of his discharge, and hopefully, ideally, over time, we will have sort of things in place, and maybe we already do, to help people who are in this situation of being in an institution and being eligible for a program and have a fast intake into permanent supportive housing. Okay, Category 2, imminent risk. Okay, court order resulting from an eviction action notifying the individual or family that they must leave, or for the household leaving a hotel or a motel, evidence that they lack financial resources to stay. Now, remember, if you remember, this is people leaving a hotel or motel that they're paying for themselves, or a documented and verified oral statement. One of those three, plus certification that no subsequent residence has been identified, and self-certification or written documentation that the individual lacks the financial resources and support necessary to obtain permanent housing. So, Drew reports that his landlord came to his apartment and told him that he has to vacate within the week for non-payment of rent. So this is one that bothered me. Like right before the webinar, Lee and I had a conversation of, well, what do we do? But we're saying yes, he is eligible under Category 2. If this is verified and provides self-certification, he has no subsequent residence, and he lacks resources to obtain permanent housing. And it is less than 14 days. The thing that bothered me on this one, and I'd like to hear from other people if we can during the Q&A, if people can like do a hand raise and Dave can unmute you. We understand that in many rural communities, landlords are less formal, and that they may come knock on the door and say you're out without a court-ordered eviction notice. And the extent to which that, I'd like to know more about the extent to which that happens. So if you don't want to talk now but want to send emails, please do. And we will be happy to send that into HUD as a phenomenon of the rural communities, that eviction is not as formal as it is in some other areas, and leases are not as formal. Yeah, so people don't have formal leases, they have handshake leases, and so, or week-to-week leases, month-to-month leases. So we really want to know more about the extent to which this is limiting programs in their ability to document eligibility under Category 2. Okay, the next one is Kelly has received an eviction notice in the mail from the court. So yes, if they are eligible, if they're going to lose their residence within 14 days, and she also provides certification of no subsequent residence, and that she lacks resources to obtain permanent housing. So if you remember, we talked about this earlier, the eviction notice usually is 30 days, and hopefully she can resolve it. But if she can't, on day whatever the number it is, where there's just 2 weeks left to go, she then becomes eligible for Category 2, which means transitional housing or supportive services only program. And she was, I guess, ended up in a shelter. Okay, Sarah and her baby are living in a hotel that charges $49 a night. She brought her TANF statement to the Transitional Housing Program intake worker, showing that she can only afford to stay one more night. So yes, she is eligible. She can't afford the hotel any longer, and she has no other resources. So yes, she is eligible under Category 2. Category 4. This one has gotten more tightened up, and HUD is really looking, and I think some of this is having to do with preparation for, and for many communities, the implementation of coordinated entry, where there needs to be systems that are slightly different from those fleeing domestic violence, from those who are not, and how how domestic violence programs are treated within a coordinated entry. So there's a lot of distinctions now being made between people who go to a domestic violence provider and those who go to a regular homeless services provider, all with the goal of protecting the safety of the family. So let's start with for victim service providers. So those of you who are victim service providers, this is what the documentation is required. Oral statement by the individual or head of household seeking assistance which states they are fleeing, they have no subsequent residence, and they lack resources. And the statement must be documented by self-certification or certification by the intake worker. The assumption here is a person seeking services from a victim service provider would be a household who is fleeing domestic violence. So the level of certification of the fleeing is not as rigorous. The agency's mission and purpose is what is the documentation. But many people who are fleeing domestic violence come to programs that are not domestic violence programs. I don't know how often that happens, but many of the programs we work with serve people who are fleeing domestic violence, and they're not DV providers. So in these cases, the level of documentation is more rigorous. Oral statement by the individual or head of household seeking assistance that they're fleeing. This statement is documented by self-certification or by the caseworker where the safety of the household is not jeopardized and the oral statement not jeopardized. Where the safety of the household is not jeopardized, the oral statement must be verified. And certification, again, that there's no subsequent residence and lacking financial resources. So let's see what we know here. Sandy and her 2 children are applying for transitional housing from a domestic violence provider in Schuylkill County. She stated that her husband hit her and one of her children. She has no money and nowhere safe to go. They both had significant bruises on their arms. Yes, however, self-certification or caseworker documentation are needed. Rochelle came to transitional housing program in Mercer County, to a transitional housing program in Mercer County, not to a domestic violence provider, stating that her husband hit her and she does not feel safe remaining at home. She has no money and nowhere safe to go. Yes, however, self-certification, and I have the word case manager certification, cross that out and put verification is needed if safety is not jeopardized. It's case manager verification, which is then certified, but it's a verification of these facts that is needed. So that's the higher level of scrutiny. Okay. Now we're going to go on to documentation of disability. Unless, actually, you know, maybe we should stop here again. Dave? You there?
Yes, I'm here.
We're stopping here again. Have any questions come in the chat or any hand raises now for anyone who wants to raise their hand now for definition of disability? I'm sorry, for documentation of homelessness?
Let me scroll up. Where are we at? So when it came around when it came to the informal eviction process, that still does happen, but legally, they have, they basically are going through the magistrate's office to pursue legal actions for eviction through that process. Another person said...
can we stop at that one for a second? Whoever sent that one in on the informal evictions, could you send us an email with more details? Because we really want to understand it, and we really want HUD to understand it.
Okay.
Thank you. Okay, next one.
The other one's pertaining to the same thing. It says, although no leases exist, often they will not reimburse, at least with the ESG funds, unless there is.
We're not talking about ESG. We're talking about continuum of care right now.
So, but it says unless they're at least with not with ESG, so they might be using other funds, like possibly CoC, to do that.
Okay. I just want to keep this for whoever asked that or commented on it and wants to do it offline through our email or call us. That's great. I just don't want to complicate this webinar, which has got too many details with ESG related things also. I apologize if I've cut somebody off.
Okay.
Okay. All righty.
Let's just check for hand raises real fast. Nope.
Okay. All right. Onward. Documentation of disability. Okay. Okay. The documentation is only required when you're documenting eligible for permanent supportive housing programs. But we'll get back to, but maybe other programs would want to, and we'll explain why in a minute. Permanent supportive housing is permanent housing with indefinite leasing or rental assistance paired with supportive services to assist homeless persons with a disability or families with an adult or child member with a disability achieve housing stability. And like I said earlier, permanent supportive housing is shelter plus care is permanent supportive housing. So those who are shelter plus care providers as well as those who are permanent supportive housing providers, documentation of eligibility is your responsibility. This is important. We've noted, though, that other programs that refer to permanent supportive housing should maintain this documentation. So if these programs are serving people with disabilities, they should have this documentation, and that way, when a household is being referred to permanent supportive housing, they are then they'll speed up their intake. So someone who's in transitional housing, originally came from the streets or shelters, has a disability, would then be eligible for permanent supportive housing. But if we don't have the documentation of disability, it slows everything down. So it's important to have the documentation in place if the person does have a disability. It just allows for faster movement through the system, faster movement out of homelessness into housing. Keeps the permanent supportive housing beds fully occupied, which is what we want, and it reduces the length of time that people are homeless, which is something else that we want. And if, once you add that one, Leah's one she's going to add.
Hi, I was just adding that it also helps that household to increase income through mainstream benefits with their disability documented.
Thank you. And I apologize for the coughing. I am a casualty of babysitting for a sick grandchild. So, anyway, definition under HARTH, an individual. Okay, so this is the definition of a disability as HARTH defines it. An individual with one or more of the following conditions. So A, a physical, mental, or emotional impairment, including an impairment caused by alcohol or drug abuse, post-traumatic stress disorder, or brain injury that 1, is expected to be long-continuing or of indefinite duration, 2, substantially impedes the individual's ability to live independently, and 3, could be improved by the provision of more suitable housing conditions. It also includes developmental disability and includes AIDS or conditions arising from HIV. So how do you document disability? Now they've got 2 levels in order of preference. The first is written documentation, third-party written documentation. Second is intake worker observations. In this case, oral third-party is not an eligible form of documentation, nor is self-certification. So this is a much tighter thing. The documentation of disability has to be done much more rigorously. So what would be third-party documentation? Written verification of the disability from a professional licensed by the state to diagnose and treat the disability, and his or her certification that the disability is expected to be long-continuing or of indefinite duration and substantially impedes the individual's ability to live independently. Or written verification from the Social Security Administration, or the receipt of a disability check. Or, in the absence of any of those, intake staff recorded observation of a disability and then written third-party verification within 45 days. So if a person is coming from the streets, intake worker really believes that this person has a disability from everything they know in their professional role in doing this, they don't have to say, you know, stay out on the streets while we look for your verification. They can be housed, but they have 45 days to get the verification in place, all those things that we'd said before. So this may not be a fully inclusive list, but these are Pennsylvania licensed professionals: a medical doctor, a doctor of osteopathy, licensed clinical professional counselor, licensed clinical social worker, advanced practice registered nurse who's board certified, a nurse practitioner, or physician's assistant. These are among the third-party verifications. Okay, who has proper documentation of disability? Okay, onward. See how these folks are going to do with their applications. Blanche has an appointment card from a chiropractor showing she has an appointment the next week. No. All we know is she's most likely in pain and may have a disabling condition, but it's not enough to show that to meet the third-party requirements. Gerald told the intake worker that he receives disability income but threw away all the check stubs. No, we must have the actual documentation. Now, if he gets disability income, there's got to be, there's got to be a way to track that back to where those checks came from. But that check must be in the file, the stub. The intake worker found Ken to be disoriented. He has poor personal hygiene. Ken presented with no paperwork about having a disability. Yes, but that's one in which the written third-party verification must be completed within 45 days. If the intake worker has a significant experience working with people with disabilities, recognizes that Ken has a disability, or has known Ken for a while, but is not one of those various licensed people, then yes, but that verification must be in the files within 45 days. Okay, I would like to open it up for questions. Also, I'd like to know if anyone is having problems getting the written verifications they need, the written documentation that they need. We've heard some counties have had problems getting mental health to provide the documentation that they need, and so they're therefore having trouble getting people into permanent supportive housing. And I'd also like to know if anyone has any really good forms that they use for their documentation for their files that they would want to share with other participants, and we would collect those and get them out to people, or we'd probably put them on the Pennsylvania CoC website as examples of ways to keep good files. So Dave, if you want to start with chat box and then hand raises.
Yeah, Barbara, there's a question related to the certification of homelessness real fast. It says, when an individual is providing a certification of their homelessness, is there a limit to the amount of time they can claim? Is there a limit to the amount of time they can claim?
I don't quite know what that means, but in terms of
the number of times, I believe, that they can claim.
There are, underneath the new chronic definition, there are limits. I don't have the exact limits in front of me, and I haven't memorized the new definition word for word yet. But that's something that we will definitely be going over in the chronic definition. In terms of self-certification for non-chronic resources, I'm not aware of any, but that's, we can double check. Barbara's saying no, so I'm going to go with what she said.
That's for self-certification for homelessness, but they can't self-certify their disability. Is that what you're saying?
For disability. Oh, no, I was just only talking about the homeless status.
Yep.
Mm-hmm.
Okay, are there other ones in the chat box?
Wait, hold on. What's this that just came in? So it says, in the past, we received the third-party written documentation. However, the criteria that is expected to be long-term and impedes the individual's ability to live independently was omitted in years past. We are making sure that this is in records, but we can go back and correct this now 2 years later. Can they go back and correct this 2 years later?
Well, here's the thing. If the person's in the program, oh, the battery's dying on that phone. Okay, we're having technical difficulties there, Ann. You want your files to be clean. If that person entered under a grant that was funded during HARTH, so that means if the person entered the program in 2012 and onward, we have something beeping in our office. We don't know what. Anyway, if the person entered in 2012, since the implementation of the Hearth Act, and they don't have they don't have the full documentation in their file, I would strongly recommend, if at all possible, get that file updated. If a HUD rep were to pull, the HUD reps can pull like 5, 7, 10 records, and if they pull one with improper documentation, you will have a finding. So yes, I think it's worth the trouble to make sure that the full documentation is there if the person entered after the implementation of the Hearth Act. If they entered prior to that, it would be good, but I don't think it's mandatory. But I absolutely, after the Hearth Act came into effect, the documentation should be accurate because the definition came into effect effective with that. Lee, do you agree with that?
Mm-hmm.
Lee agrees. Okay.
Mm-hmm. All right. So next question is, does the person...
I just want to, Dave, before we go on, I just want to say one additional thing to that individual who asked the question and anybody else in that similar situation. HUD looks at, was that person eligible based on the criteria required at that time? So the reality is that if the documentation cannot be obtained for whatever reason, as long as it met whatever the requirements were at the date of entry for that individual, they'll be fine in terms of their monitoring. I think if they don't have any of the documentation as it's currently being described, you know, it may be useful to have it for eligibility purposes for other types of programs, such as if they're not receiving SSI or something like that. But in terms of a HUD monitoring finding, I think, again, as long as they met the criteria that was in place upon program entry, it should not be a monitoring finding.
Right, which means with the beginning of Hearth, this is the requirement. Okay. Okay, Dave, you had another one there?
Yeah. Does the person doing intake for transitional housing need any special qualifications such as social work or mental health background?
Nope. Nope. No, it's whatever's appropriate to the agency and to that program. Right. HUD does not put any standards on who works in a CoC-funded program.
Okay. And then I have one other question. It's what can be used as verification of domestic violence?
Okay. That's a good question. I think, let's go back. I think, well, if the person presented from a domestic violence agency, there we are, okay, because they are by definition the ones who would certify that. But I think, okay, we'll go back. We're finding the right slide there.
Slides 44 to 46. Okay,
slides 44, 45, and 46. So we look at oral statement by the individual or head of, that's for victim service providers. If it's a non-victim, okay, we just start with victim service providers. Oral statement by the individual or head of household seeking assistance, which states they are fleeing, they have no subsequent residence, and they lack resources. Okay? The statement must be documented by self-certification or certification by the intake worker. So that is for victim service providers. For those who present to a non-victim service providers, oral statement by the individual or head of household seeking assistance that they are fleeing. The statement is documented by self-certification or by the caseworker. Where the safety of the household is not jeopardized, the oral statement must be verified, and then on into the no subsequent residence. So it's basically oral it's certification that I'm fleeing. Was that the question?
Yes.
Okay.
And the person who raised their hand is not connected to any audio, so.
Oh, that's a shame. Okay, if the person who raised their hand has a question that they'd still like to ask, feel free to type it into the chat box in the next couple seconds, or send it into an email, or call one of us.
Mm-hmm.
Okay, my number is 215-576-6410. And again, if questions come in after the webinar that we believe are of general value, we will get it out to everybody, so no one will miss anything. And we'll put it on the website because some people will be doing the webinar through the website. Anything else? I know this is kind of a difficult way to ask questions, but that's the role of a webinar. Okay. All right. So.
Nope, that's it.
Well, I have 2 more slides with what's happening here. Okay, good. Thank you. Okay. Okay. We'd like some additional input. And it looks like there's another hand raised that came up on my screen quickly. But anyway, you look at that, Dave, and I'll look at this. What we'd like input from you folks. If you have tools for documenting program eligibility, if you have a tool that your agency currently uses to document and you think it's a really good one and it follows all these definitions, we'd love for you to send it in to PACOC. If you would like to suggest topics for future webinars, you saw the list that we already have compiled. The next webinar is the new chronic definition, and that one in particular, if you could get questions specifically about that in soon, we'd be happy to incorporate that into the webinar. The third webinar is question and answers about implementation. It will include match and leveraging, utility allowances, income calculations, and questions you give us. And the third one is discussion of low barrier policies and implementation. That's where we are. Those are the proposed webinars coming up. But the next one is chronic, and we very much would like, next one is Tuesday, March 15th, 1:30 to 3 o'clock, the new chronic definition and documentation. We hope to get an email out this week and the PowerPoint out just prior to the, hopefully by the 11th, the Friday before. If not, it'll be the Monday before. And then Dave will send out the registration information, and we're doing this all over again pretty quickly. So hopefully the registration went okay. It seems like people got on. We haven't gotten hundreds of emails and phone calls saying, where's the webinar? So this is good. Anyway, any additional questions, comments, anything that people would like to add at this time? Dave, you're the one who knows.
I'm trying to think, is this webinar different than the one that was previously hosted by DMA?
The one we gave today is the first time we've done it, so it's different. I don't know what other one.
We had a webinar in January that was specific to the pig count, and then we had a webinar in the fall that was specific to the NOFA.
Okay. And the one for chronically homeless is coming up.
That's March 15th, yes. The chronic one is coming up March 15th. That is correct. And that, yes. Okay.
All right.
We are okay then? Nothing else is popping up on your screen there, Dave? Okay, well, thanks for your help, Dave. Thank you, everyone, for participating. We hope this was helpful. We're totally open to input through emails and phone calls, and looking forward to talking to you again in 2 weeks. Okay, have a good day. Bye-bye.